Good afternoon, everyone. I am delighted to welcome you to the next iteration of the Pennsylvania Coalition for Oral Health's webinar series, Growing Pennsylvania's Oral Health Workforce Through Residency Programs. This webinar will be recorded and shared with registrants, so please remain muted to eliminate any background noise. There is going to be time after our presentations for Q&A. Participants are encouraged to use the Q&A feature located at the bottom of your screen. Our agenda today is a continued exploration of the factors needed to build a diverse and competent workforce. We are joined by Dr. LaJuan Mountain and Dr. Paul Bahn, who will share their perspectives and experiences in dental residency training. But before we hear from our presenters, I would like to welcome Helen Hockey, Executive Director of PCOH, who's going to provide an overview of the current state of dental residency training as it relates to access to specialty care in our state.
All right. Well, thank you so much, Nicole. Promise I won't talk too long because we've got some great speakers that we want to hear from today. But we wanted to give a little bit of background sort of on the work that's been happening in Pennsylvania and the information that we know just sort of in the general gist of the work. So when we look at workforce, of course, we also need to speak a little bit of our state's Department of Health Oral Health Program and the state Oral Health Plan, which is a 10-year plan that does highlight oral health workforce as a priority. So if you aren't familiar with this plan and you haven't had a chance to review it, I would highly encourage you to check it out. We're going to send the slides out after today's broadcast, and you will actually be able to click right on the link there, and you can see all of the strategies and action steps that are recommended within the plan to focus on oral health workforce. So when we look at the work that we're talking about, first off, sort of the number one thing we look at when we talk about dental workforce most of the time is the availability of dental providers to the general public. And so there are federal designations in place that probably most of you are familiar with, the dental health professional shortage areas. Those are basically set up to determine if there is one dentist per 5,000 people in a region. And that is basically considered the minimum threshold. Anytime we go below that, then we're going to say that area is a shortage area. So in Pennsylvania, you can see all of the dark colored counties on this map are considered entire county shortage areas. So that's a pretty big deal. That's something that we see a pretty big wide swath of Pennsylvania that falls into that category. And what's really telling is that when we compare the numbers of dental provider shortage areas to other professions like primary care or behavioral health, we see that we actually need more dental providers per capita than those other specialties. So we consider it a pretty big deal. We know that we need about 300 providers to fill in all those gaps. And as I usually say, when we talk about those shortage areas, just needing 300 providers isn't really enough. We need 300 providers that want to practice in only those really dark blue communities. And so that makes it pretty tough. So the next one, when we've got the next slide we wanted to share, we were really fortunate to look at some data over the last couple months and wanted to sort of share where Pennsylvania stands on residency requirements. So we have 9 states across the country that do require some type of completion of a post-grad year to get initial licensure. So when we look at that, we say, okay, not a lot of states, right? So dentists that want to practice in those states are going to have to commit to additional schooling and education. But what I think is interesting is that we see 2 of our bordering states, both New York and Ohio, do require that initial residency before licensure. And those states typically have less trouble than we do retaining dentists and getting dentists. So it kind of makes us wonder. We do not require any type of postgrad training to get that initial dental license in the state. So the only way that you are required to do a residency is if you want to practice in a specialty field like pediatrics or oral surgery. So some really cool numbers, and thanks to Nicole for writing these up for us. They're pretty amazing. We've got 51 accredited residency programs in the state. And that's a number that I didn't even know myself a few months ago. When people would ask how many residency programs are in Pennsylvania, I'd say I have no idea. And so that's really where we got the idea that we probably need to explore this a little bit. So as you can see, the concentrated areas of residencies are the yellow dots, the highlighted areas. And there are some pretty big areas of the northern part of the state that are lacking those programs. So the one thing I did want to point out in this is that we do have a number of models out there where a residency program may be based in a city like Pittsburgh, but they could have practice sites in other areas. So some of you are probably familiar with the University of Pittsburgh's new up-and-coming program where they're going to be placing residents out in rural areas like Titusville and Johnstown. And so this map does not account for that. So I do want to make that clear that we're not covering all of the satellite locations in that space. So the next map I want to point out, we're actually demonstrating kind of two different sets of data here. And I want to make sure it's very clear. We're talking about all the dentists that are practicing in Pennsylvania. These data actually come from the licensure survey. So when providers are renewing their license, they indicate, if they're practicing and providing direct patient care, and also what county they list as their county of primary practice. So that's kind of where these numbers come from. So these are not maybe, say, an oral surgeon who retired 5 years ago but still keeps up a license. This is actively practicing and also listing that county as a county of primary practice. So all of our data that we're using on these next couple slides come from that. So when we look at these numbers, we look first at the shading. So that shading is based on how many dentists, general dentists, and specialists there are per 100,000 people. So you can see the darker areas are where we have more concentrated numbers of those providers. The lighter shaded areas, the white areas, are where we have very few dentists and specialists. Now, on the flip side, the other set of data that are portrayed here are actually dealing with just the straight numbers of providers. So in Allegheny County, you can see there are more than 800 dentists and specialists that list Allegheny County as their county of primary practice. So it's kind of two different sets of data that I think we kind of need to see side by side to see if there's comparisons or changes that we need to be making in that space. And again, we highlighted in yellow the residency training programs. So we wanted to see, is there a correlation between number of where people end up practicing and maybe where they were trained in their residency? The next number is we removed all the specialists from this map. So now we just have general dentists. So again, highlighting the areas where there's residencies, but also looking at first, let's look at the shading, right? What do we see here when we look at the shading? We see a pretty evenly spaced amount of dentists per capita around the state. Still not quite enough, right? So the ADA typically recommends at least 60 dentists per 100,000. So when you look at the shading here, we would want to see those dark blue counties. Those would be the only ones we would consider sufficient for general dentists. So most of the state is not. Some of the states are in pretty bad shape with, maybe less than half or less than a third of the amount of dentists they need. And again, just general dentists. The second set of the data on this map are talking about the numbers, right? So again, how many just general dentists, not accounting for population, are in each of these counties? So again, looking at Allegheny County, we can see there's over 500 practicing general dentists in that county. So I think it's interesting. It gives everyone a little bit of perspective. We hear a lot about how dentists are becoming less and less accessible, especially for certain populations. And so we kind of really wanted to map it out and see, what does that mean? What are we seeing? So the next two slides, actually the next three slides, we dive in a little bit further on the specialist side and thought that was especially relevant for a residency program like we're talking about today. So when we look at all specialists, so this is including any dentist that recognize that they're board certified in a specialty, and that they're actively practicing, and then the county that they actively said they're practicing in as their primary practice. So this is all specialists. This could be pediatric dentists, this could be orthodontists, this could be oral surgeons. Again, some decent numbers in some areas, of course. We see the southern tier tends to do better than the northern tier of Pennsylvania. Our more highly populated cities like Philadelphia and Pittsburgh tend to do okay. But you can see that swath across the northern tier again, where we've got a 4-county range there across that northern border with New York, where we don't have any specialists practicing at all, which means folks are going to have to drive into other counties to even find one. And so that brings up a lot of concern for us. Now, we did break it down. The next 2 slides we broke down into 2 specific specialties, primarily pediatric dentists and oral surgeons, because those 2 seem to be the specialists we hear the most about there being shortages of. So wanted to share those numbers with you guys before we hear from our presenters today. So pediatric dentists, all I'm going to say is wow. I didn't expect it to look this bad when we started kind of pulling all of these numbers, but as you can see, there's definitely a desert across the top of the state for folks looking for pediatric dentists. And again, this is all reported from the licensure surveys, which is nearly every dentist in the state completes them. It doesn't mean there couldn't be somebody who has a secondary practice in a county that's shaded white there. But for now, for the counties of primary practice, these are the deserts that we're left with. And so I think we see a need, especially for that pediatric residency, to possibly be taking place in that northern tier. Maybe we could start to fill in some providers there. So again, very interesting data. When we look at the next slide, we're going to look at oral surgeons a little bit better. We've got a little bit of an improvement here, maybe not quite such the desert across the northern tier, but still a little scary when you think about folks that are up in those northern counties and when they need to drive to find an oral surgeon, especially if they're not able to go into New York State. If they're going to be driving south, east, or west, they may have a few counties to drive through to find an oral surgeon. And, as we see the division between what general dentists are doing and what they're leaving to the specialists now, many general dentists are choosing not to do more complicated extractions. They're choosing not to see kids. And so what this means now is that we have those populations really relying on our specialists. So these desert areas kind of concern us a lot in that we've got to try to figure out how do we get some of these specialists to practice right in those areas. So with that, I'm going to stop talking because we have some great speakers here. And first, I want to introduce Dr. LaJuan Mountain, who is the Vice President of Dental Services at Family First Health. And she's going to talk a little bit about what Family First has been doing in their general residency program. So welcome, Dr. Mountain, and please just let me know when you need slides advanced, and I will advance them for you.
Great. Thank you, Helen. Good afternoon, everyone. As Helen said, Dr. LaJuan Mountain, been working at Family First Health. It'll be 21 years this fall. You can go ahead and advance the slide for me, please. So just going to share with you all a little bit of who we are. So we're located in South Central Pennsylvania. Our counties our service area covers the counties of Adams, York, and Lancaster. We have one site, Gettysburg. We have 3 locations in York, Hanover. We have 2 locations in what's considered York City. And then Lancaster County, we have a Columbia location. Our department is comprised of 5 brick and mortar dental sites with a total of 56 operatories. We have a pretty decently sized mobile school program where we provide preventative care to the students during the school day with mobile equipment, setting up in the gym, classroom. The team is made up of 17 staff dentists with 7 hygienists. And just this past year, we entered the realm of working with the GPR. So we also house 8 general practice residents. We provide comprehensive care. We also have an urgent care model that solely functions out of the practice that I'll talk a little bit more. I'll talk a little bit more about Springwood Road practice, which is where the residents not solely, but that's their main clinical site. You can move to the next slide. So we partnered with WellSpan Health, which is one of the local health networks in our area. We went live with the GPR functioning as their clinical site January 6th, 2025. So we literally just had our 1-year anniversary. So as I stated before, we're providing we maintain basically the operations of the site, all the things that happen in a dental practice. We employ the staff dentist, the hygienist, as well as the support staff. WellSpan Health is still sponsoring the GPR, and they provide the hospital-based interdisciplinary inpatient treatment training experience, and they still employ the program director and then the residents as well. So they're still their residents. WellSpan offers them a pretty decent package. I know that was one of the questions that was sent out by Nicole. So their salary is $70,000 annually. They're given 5 CE days. They're given $1,600 in CE dollars. They're allotted 5 days for interviewing, $500 for moving expenses, and they get 12 PTO days. So they have a pretty solid package as residents for that 1 year. They also provide malpractice and health insurance as well. So WellSpan is still receiving the GME dollars. We are not getting those dollars, which is what covers the salary and allows them to pay for all of the other fringe that the residents are receiving. Can you go to the next slide, Ellen, please? Okay. So we found ourselves in a space of collaboration because WellSpan was evaluating if the residency was still an appropriate fit for their health network. Obviously, to have 8 residents, and at the time it was 5 staff dentists, no longer provide care in the community would have provided an extreme deficit to York County. So they reached out to us, the local FQHC, to see if we would be willing to facilitate keeping this GPR in the community. And of course, we were like, yes, because if you shutter your doors, there's no way we can then accommodate the patients that will no longer have a dental home. So the model works because we're both mission aligned. We were able to maintain access for the patients, allow them to continue their care, and then get dental students into our community so that we could start to introduce them to opportunities in our region, and hopefully they decide to stay in our area. You can move to the next slide, Helen. So this is our front desk at the Springwood practice. We refer to our practices either by the street they're located on or the city that they're in. So this is Springwood Road, which is located in York. The residents, like I said, this is their primary site, but they also rotate through our mobile school program where they provide care, and they'll be this upcoming year rotating through some of our other locations. You can advance the slide. And this is just the really nice looking lobby, the waiting area for the patients. And you can see there, both of our logos are there. So if you were to walk into this site, the dental practice is on the left side, and WellSpan's family medicine practice is on the right side. So we share an entryway. We each have our own check-in, but this is a facility that is offering family medicine services as well as dental services. If you could advance to the next slide, please. Okay, so a lot of this I just stated. Some of the interesting and unique information is when we acquired this site, we acquired 24 operatories. There are 24 operatories at this Springwood location. At this location, as I stated before, we have staff dentists, we have the residents, we have hygienists, and we also have FDIS functioning in this site. Maintaining the residents' involvement in this community, the residency has always treated the same patient demographic that our FQAC has treated, so they were able to just slide right into that space without any problems. Can you advance the next? So when we were on the clock, once we understood that we were going to partner with, we literally had a 60-day turnaround. So the decision was made and our CEO stated 60 days. So I think our first meeting started October and our first day of patient care was January 6th. So there was a ton we had to think about and consider because we were going to basically we are providing the clinical environment. So as stated before, we have urgent care. We're providing comprehensive care for everyone. Just like most GPRs, there is a day where the residents are treating neurodivergent patients. We are providing removable dentistry. There's a lot of oral surgery or extractions that are happening at this site because we run an urgent care. So it's a walk-in urgent care with hours from 8 to 2. So they get a great exposure in managing emergency patients, treatment planning, and then actually delivering on that treatment, providing the service. There are root canals happening at the practice. There's some implant restoration. And then again, as I stated, they're being exposed to a mobile program and engaging kids in their educational setting. Their hospital-based experience, WellSpan is providing that. They're going to the OR. They have emergency room consults, inpatient consults, rotations with anesthesia, internal medicine, and then they're on call. There's a scheduled call for 24 hours. So the goal that we went into this with as an FQHC was to hopefully have some working interviews to expose the residents to our environment, the care that we're providing for the patients in the community, but to also strengthen and enhance their treatment planning, to help them grow their clinical judgment, to teach them how to communicate within the team. As we know, you come out of dental school and you've not worked with an assistant, so that a ton of time is spent there with them on working within a team and effectively communicating. Care coordination is something that they're exposed to because in FQHC we have a decent amount of community programs that we often coordinate with to ensure that our patients in the community can connect to us to receive care. And then ultimately, we want them to leave being able to treat an appropriate volume of patients and to be ready to independently practice and not feel as if they need feedback and the okay from a staff dentist. And of course, we want them to stay and work with us. Like I said, we treat it like a working interview. You can advance the slide, Helen. And while she's talking about that, the other thing to consider, we're going to talk about considerations. One of the things that we consider is what was going to be the goals as far as patient volume for the residents, because this was new to us. And in talking to the program director, who was still a WellSpan Health employee, just understanding historically how he approached the management of the patient volume for them. So we started with the ramp-up schedule. So they started with 5 to 6 patients. We scheduled a touch base where we would have a conversation with them. That was a date on the calendar where we would discuss increasing their patient volume and evaluate the treatment mix of the treatment type mix that they actually had in their schedules. And to spend time talking to them, not just about volume, but the content of their treatment plans, because they can see a large volume of patients, but if they're not expanding their knowledge or they're not learning or pushing their skills in certain areas, that was going to be a problem. This past fall, myself and another VP in the department participated in the first round of resident interviews. So we learned a lot. And the reason why most of them are obviously choosing to do residencies, they want to expand their skills. So they'll tell you, unless it's a unique clinic, they're not dealing with or they're not engaging patients in dental school that may have some chronic healthcare needs. So they want to understand how to manage that. But then just the exposure and the touches, the volume to certain procedures. So they all are looking to do more molar endo. They want to learn more about removable treatment planning. They want to do more crowns. So they're wanting to enhance their exposure to a larger volume of treatment is the goal. So some other considerations here is there were components of this collaboration I was not involved in, but yes, I did have to learn about all the written agreements between our two organizations to make sure everything that needed to be spelled out was spelled out. And everyone knew what they were supposed to be doing, what they were responsible for. Another thing that we had to consider is WellSpan credentials their residents, but we also needed to credential them as well. So we had to do professional credentialing. There was no need for any insurance enrollment because all of their services are billed under the teaching doctor, which is the next bullet point. Supervision, review, and billing of services was something that we had to make very we had to be very clear on as an organization. We employ the staff dentist, but we do not employ the director. So the way we are set up now is that the director functions as the staff dentist 4 out of the 5 days unless he's on PTO. On Thursdays, he's in the OR. So then our staff dentists are rotating as a teaching doctor. So having that spelled out, understanding what that meant for us for UDS, how we reported out on our visits. The HRSA compliance, more of that was obviously around, again, the provider of record, making sure the residents understood the sliding fee scale, because as I stated before, they want to do all the things. So they want to do all the things, and they would love to do all the things under a slide 8, which is obviously something that we have to manage to ensure that they're approaching the clinical care appropriately. Quality improvement and clinical standards. So clinical standards, we're talking about PPE, we're talking about infection control, things that we had to introduce to them as dentists that were going to be functioning in our environment. So, of course, there were obviously implications and impact to our operations that was really new to us. So they're slated to do 7.5 hours a day, but that all changes depending on whether or not they're in the OR. That changes depending on whether or not they have lecture, whether or not they're on PTO, they have CE, all those other things. Was introduced to ADIA and PASS to understand how the residents initiate or engage with the whole registering to apply for the GPR process. So that was something else that we had to consider, and we had to learn to understand. The technology is also something we had to consider, because the EHR that's used in the hospital is different than the EHR that's used in our dental practice. So the residents were trained on 2 systems. What else did I want to talk to you all about? I think I spoke really fast about all the things here. Their skill level. There's not consistent, you can't expect they're coming from different learning institutions. So understanding their skill level at intake and really figuring out how you're going to support them to grow, to ensure that at the end of the program, they are a stronger, improved, more well-rounded dentist. So that is something that we are diligently working on to approach differently for this new upcoming class, since we've just finished. Well, we'll soon be finishing our first year with the residency. And that is all that I have. So thank you all for listening to me speak through our 1-year journey that I could report on.
Well, thank you. I know I have found it very, very interesting. We've worked with WellSpan for years. We've worked with you guys for years, and it was like knowing 2 of your favorite people that got married. It's like, yay! So the work that you guys are doing is great, and I love that it's expanded your reach in the area. So thank you very much for that.
Yeah. Thank you.
Sure. So we will move on next, and we'll have some time for some questions at the end. But next, I'm going to ask Dr. Paul Bahn to join us and share a little bit about pediatric residencies and his experience in Pennsylvania. So thank you very much, Dr. Bahn, and happy to advance slides for you as you need them. Just let me know.
All right, cool. Thanks for having me. I'm going to try to do this in about 10, 15 minutes. So I was asked to talk about pediatric dental residencies within Pennsylvania. So if you want to go to the next slide, I can give you some background about myself. So let's talk about an overview. What we're going to talk about. So I'm going to try to hit on where the residencies are in Pennsylvania. Helen's kind of done some of that. Where do our dental residents actually come from? So where are we pulling them from? And then I'll try to give you some guidance about where they go to when they're done. There's some trends and applications that I've seen over the last 5 to 10 years. I can talk about that. What does our care model look like within these programs? That's going to be tough because I don't know all the programs. I can speak for Temple where I'm at. I can give you an idea about other places, but we're unique and we're not like everywhere else. So all these programs are run very differently and very uniquely. And then what the affiliations or connections we have with other programs. So I will talk about that. But again, I only really could talk about Temple because I've lived my whole essentially career here for the last 20 years. So we can go to the next slide then. So, okay, about me. I'm a board certified pediatric dentist. I've been here in Philadelphia for about the past 20 years. I practiced about a year or two in the main line. Enjoyed it, but realized my calling was here. So I ended up just coming back here. I was trained at this program. I was cut from this cloth. I enjoyed it. I didn't ever think I would be in education. I thought of, yeah, I grew up outside of Harrisburg. I grew up in Cumberland County. So I'm like, yeah, I'll go back to Cumberland County where I grew up. It's my calling. I'm going to go back there and practice and, be one of the 6 pediatric dentists in the whole county. That didn't happen. So I met my wife and we got married and got set up and, ended up staying in Philadelphia. So I did not anticipate this, but this is what happened. At any rate, so I try to stay involved in organized dentistry as much as possible too. So I'm the first district trustee for the PDA, treasurer, and all this other fun stuff within oral. I do oral boards, so a lot of stuff with pediatric dentistry. So I have a good feel for what goes on in a lot of other programs too without the country. So most importantly, my dad. I got 4 kids, a dog, and married. So, but anyway, go ahead. Next slide. All right, so to kind of elaborate, I think a little bit on Helen's. So to break down just the pediatric dental residency programs, so where are they at? So Eastern PA, Temple, where I'm located at, we have 18 to 20 residents. So why is there a fluctuation? So there's a fluctuation. There's 2 minus signs there. That means we are losing 2 residents next year. Whose fault's that? It's mine. It was my own choice. It was our choice here. I can explain that in a little bit too. So St. Christopher's, who's literally 2 miles down the road from us here in Philadelphia, they have 16 total residents. So pediatric dental residency programs are 24 months long, so essentially 2 years. University of Penn or CHOP, they are paired together. They have between 10 and 12 residents. So then they've expanded. So they added 2 residents this year. And there's a dollar sign behind that because they actually have a tuition they have to pay to go there. They also get a stipend. So Temple, just like the WellSpan folks, they get a stipend from the hospital. St. Chris does as well. CHOP and UPenn have basically they pay X and they get reimbursed X. So Central PA, if you want to call it that, it is Central PA, but Geisinger is kind of up there. They have 8 residents, so that's the little burst on the map. So the orange on the map are the dental residency programs. The blue are the dental schools. And again, Lee Comm's kind of different because it's not really a full-time dental school, but it's up there. Western PA has 2 programs within the city. So one is at the dental school. So again, that's going to run and operate at a different pace and different everything versus the Children's Hospital up the road. So one has 4 residents and they pay to go there for tuition. They also get, I believe, some form of stipend, but it's small. And then the Children's Hospital has 8 total residents, which get a stipend. So real quick, why'd we expand and contract? So Penn CHOP, they expanded for whatever reason. We contracted for the reason that the quality that we felt the residents or the residents to be the incoming residents has been decreasing over the last few years. This is probably a function of COVID. Requirements went down within dental school, exposure went down within dental school. Dental school is still 4 years long, but there's more technology, there's more things to learn, there's all these things. So it's you're trying to put more and more stuff on a plate that there's no more room for. So these residents a lot of times are coming into our programs, in my opinion, they're not as well prepared as they need to. So we need to spend a lot more time on the front end trying to get them caught up, basically, finish their D4 year of dental school to try to get them as much as they can. And we have a very, very high, high flow practice. We see a lot of kids. So you got to move when you're in peds. It's not take your time. So that big swath in the middle, obviously, is where we're all missing. So it's all through Central PA, Cumberland County. So again, would it be great if Hershey got a residency program? Absolutely. I'm sure it would help. But there's really not another, medical area or probably medical center that could support a pediatric dental residency program because there's no pediatric dentist there to teach. So you can go to the next slide then. So who do we see? So from a pediatric dental standpoint in our program, we will see kids from day 1 of life up till about 18 to 20. And that's not every place. Some places will stop seeing pediatric patients at 12. It's probably a function of they don't have the staff, they don't have the facilities. They're already so busy. The wait times are so long that once they see kids past 12, they would not be able to get their other kids in and grow their practices or continue to just maintain the volume of patients. They would have an extremely high volume of patients, but they wouldn't be able to get people in a routine, probably regimented recall system. So we will see kids from about 18, sometimes a little more than that, and then we'll transition them out of here to adult land. But yeah, sometimes there's 12 is the oldest, sometimes 10, sometimes 14. So we will see them through their teenage years because honestly, it's really hard to find someone that wants to get a teenager in their practice. It is not, teenagers are tough patients. We love them, but they're just tough individuals. So we try to keep them around here as long as possible to hand them off in the best care as possible. So we will refer them to community dental clinics, FQHCs, other dental practices here within the Philadelphia region, local offices. So that's where we usually take folks when they leave here. And then we get a lot of referrals from, ironically, a lot of those community centers, which is fine and good because they don't have the facilities, the sedation abilities, the abilities to do operating room cases that we do. So we gladly take those individuals in. We can see them and then either continue seeing them as patients here in our clinics or return them back to their home base for convenience. And we actually do see a lot from other pediatric dental providers within the city because they either don't want to deal with certain cases, they don't have access to the operating rooms like we do, they don't have the sedation license or don't want to deal with certain things. So we kind of we're the end of the line sometimes when it comes to stuff, which is great from an educational standpoint, but it does put a pinch point on things. And as far as we go, we do a lot of unique things. The individuals at certain children's hospitals, especially CHOP and I'm sure UPMC, see a lot of the really, really unique, like severe complex cases that might be multi-specialty involved. We don't always see that. We do have those kids here at our program, but not as much as some of these other programs. So again, that can sometimes bind up and slow the workflow within a residency program because you have so many kids with so many unique needs. But at our place, we do a lot of complex cases. We do a lot of minimally invasive stuff depending on the kid's needs. We try to educate the residents as much as possible on the newest things from lasers and all these other expensive things, which sometimes limit programs too. They don't have the finances to buy very expensive pieces of equipment to teach individuals and then utilize. So you can go next slide. So where do our residents come from? Again, like I said, I only really can speak for our residents. Roughly, again, this ebbs and flows. We get about 165 applicants each year for what was 10 spots, which will be now 8 spots, and I'm sure that number won't change. For whatever reason, the number peaked around 2020, 2021 cycle. We were getting like over 200 applications, I feel, around there. So I feel like everyone went to dental school, they didn't have the greatest education. Like, hey, I'm going to throw my hat in the ring and see if I can get into pedo. And we saw a lot of applicants at that point, and it's actually back down to pre-COVID numbers now. So pedo is the second largest specialty in the country. Ortho is the biggest, from what I understand. But our numbers are back down there. A lot of individuals come right from dental school. Very few come from GPR and or work or military experience. So again, a lot of our residents are coming right out of school. They're pretty green, and it's a very female-dominated specialty, or at least from an applicant pool at this point. I feel, again, I don't have hard numbers. This is really just me shooting from what I remember. But for every 5 applicants that are female, we have 1 that's a male. So we don't have a lot of male applicants in the mix. Again, from our program, a lot of the residents are from the Northeast. That's not just like Northeast PA, that's just the Northeast in general. So a few come from outside the bubble of the Northeast and the Mid-Atlantic areas. And we also use a match system. So match, basically, if you don't understand that, we interview all these folks, they interview all of us, and we put a big long list together of who we want, and they put a long list of where they want to go, and this computer system magically spits out this number. So not every program uses a match, but we do. So you don't have full control over who you're going to get. You do if you don't put them on a list, but they have control over where they may or may not go. So it's a little cumbersome, but it does work out usually. So and then dental school, there's a lot of debt from dental school. It's absurd. Most schools now, just talking to the residents, I mean, most schools between $75,000 and $100,000 a year. So do that times 4 plus any kind of college debt you have on top of that. So I'm going to touch on that in another slide or two here. I think why people go where they go. So you go to the next slide then. So the residents ready for residency? Well, not so much. It depends. So some are great. Some come in with a great attitude, good hand skills. They're ready to rock and roll. They are great. That's not always the case. So a lot of times we have some folks we need to put a little extra time, a little extra effort into, which is fine because we're all in education. But sometimes that becomes not just one, comes two, comes three a year, and it really slows things down. So what drives our residents? I mean, some are very self-driven, some want to grow, some are, everyone's very different. So a lot of personalities, a lot of different individuals that we end up teaching. So they have to, kind of adjust and accommodate to all different teaching styles too, which then that makes it a little trickier too. What else do I have on here? So, and clinically and emotionally, they're not always prepared for this. So we're very, at Temple, we are very straightforward with our program. This is what you're expected to do. This is what you're expected to, see, and this is what you will see. Sometimes it's, the talk doesn't always, I don't think they always believe what we do, but it's a lot. So it's a lot it's a big growth step, especially if your dental school has been pretty light. So, like I said, dental schools are still 4 years long, and you're still trying to shove a lot of stuff in that 4-year period. Residencies are still 24 months long. I have more and more to teach these guys and show them than time allows. So, but anyway, so good. Next slide. So again, our program is predominantly Medicaid based. I would assume that's most of the programs, just geographically, because we're all located within major cities, and/or Geisinger's kind of up in Danville. So it's out there. Again, a lot of us share roles with the medical team doing complex cases, whether it's with oral surgery, whether it's with the HEMONC group, whether bone marrow transplants. There's all kinds of stuff that we get involved with and have to be involved with. So it does take a good bit of time. Our model here, we do a private practice kind of exposure and model. So our residents get a lot more speed and exposure to that. So it's a little different than most places. It's a kind of the unicorn. It's not really the normal. Some places do use FQHCs, we do not. And then some places are based out of dental schools. So the volume and the amount of patients that they see and the complexity of cases sometimes are different than what we would see in a hospital-based program. So I think one of the things that we have been very fortunate about, I have 13 to 14 attendings available. That's unheard of. It's a wide amount of attendings. Getting attendings, people that want to teach, that are able to teach, willing to teach, is sometimes very difficult. So to try to get obviously someone in North Central PA to leave a program, set a program up, or even set up an office, that's a big undertaking. So, and also within the state too, again, I talked about a little bit of limitations. So sedation, again, if you weren't trained in sedation, it's not something you just pick up on a weekend course. I hope you don't. It's not something you just like read about and say, I'm going to start doing this tomorrow. So sedation takes a lot of training. So if you were not trained with sedation and trained well with it, you are probably not going to do it when you leave. So again, it becomes less and less individuals offering it. So those kids are either getting shifted to sedations if it's available, or they get shifted to the OR or under general anesthesia, which again can be limited access. So it does create some more bottlenecks too. So that really varies by program. You can go to the next slide there. I'm almost done. I think. So operating rooms access, again, we're very fortunate in our program. We have 3 short procedure units that are strictly ours. So we have the access is not an issue here at all. We have the staff, we have the ability. So we're kind of fortunate. We're kind of spoiled. We have our residents up there 2 days a week, seeing cases, and we supervise them. So, which is great. But, this is not Hershey. This is not Altoona. This is not, middle of nowhere PA, so they don't have these access to these things. So it's very difficult. I can't even imagine practicing in a place like that. It's tough. Again, these facilities are twofold. One, it's great for the patients because they can get in very quick and fast. There's not a wait. We can get people in within a month or less sometimes. So it's amazing. And the nice part is it gets our residents more exposure. The more stuff they do, the faster they get, the better they get. Everybody wins. So, all right, next slide there. All right. So where do they go afterwards? So they've did 2 years hard time in Philly or Pittsburgh or wherever they did. And so where are they going now? So, I thought I was going back to Cumberland County. I didn't go back to Cumberland County. I stayed in Philadelphia. So a lot of our residents, I feel, either return to family or home or a geographic, closer to home. So we have a lot of residents that have graduated over the past few years. They practice with Sprout Dental, which is up in Honesdale, which is up in northeastern PA. We've sent probably 4 or 5 residents there over the past year. So there is a group of females. There is probably about 4 or 5 in the practice. They all practice under the same roof. They serve a huge underserved community all up through Northeast PA. They've all been trained by us. But again, a lot of them went back there just because that's home. And then a lot knew the other residents and they felt they were comfortable there. And, one way or another, whether it's a spouse or whatever, they ended up going there. So we've been trying to keep Northeast Pennsylvania covered with some pediatric dentists, and the ladies are doing great up there. So again, a lot of times spouses influence this. I feel like a lot of times the spouses of the residents are in the healthcare industry in a professional field. So again, going to somewhere, isolated or quiet or more rural isn't always, something that's possible, unless you have that unique little situation where someone else could practice there. So that doesn't happen a lot. A lot of times people they're younger too. Everyone's young. Everyone's under 30. So they want to stay in the city. They want to stay in the cities, where it's loud, it's this, it's that, it's everything else. And, I'm at the point where give me in the country, I don't really care. So, and I talked about the bills, and a lot of times these guys are leaving, the residency here because again, they don't pay their loans usually back during residency, or if you are one of those institutions where you have to take more loans on, then you have to take on living expenses. Interest rates are high. These guys are leaving with $400,000, $500,000, $600,000 in loans, so that's a lot of money. So they have to go someplace where they're either going to get the money to pay for these, so higher paying jobs, or I actually did this. I did National Health Service Corps loan repayment. So I did that, which was huge. I thought it was great, but again, I did it in Philadelphia. You can do these things outside, but it's nice that they have a program or a place set up for you. And a lot of times I feel the residents, when they leave, they want mentorship. They want someone they can work under, they can learn from. So again, if you're going out where no one's at, it's really hard to learn when there's no one there to teach you. So, I talked about the ladies up at Sprout. So, all right, what else you got? One more, maybe a slide or two. So that's it. So there's lots of variables. Again, I'm just looking at this year's class when they're leaving. I think we have actually 2 going out to Harrisburg out that way. So I'm very pleasantly surprised. That's not something we usually see. A lot of people stay, on the Eastern Seaboard within New Jersey. Everyone wants to move to New York after residency, Philadelphia, big city. So to have someone move out in the rural PA or out even like that way even is pretty remarkable. Again, education is not going to get cheaper. So again, it's going to be more expensive for individuals. Are people going to go less into dentistry because it doesn't make sense? That might be an option. I don't know. I don't know numbers on who's retiring. Again, are people retiring sooner or earlier? Are they sticking it out? I don't know. So again, I don't know the turnover there. Another big thing too is just access to all the places that we have, at least at our facility, to treat our patients. I mean, I have all the resources I think I need. I'm spoiled. I feel very fortunate, but I know that's not the reality throughout much of the state. And that creates barriers for patients to get care, and then for us as practitioners to set up places that we can go to those places. We don't have those resources, so it's not that attractive, or we feel like we have our hands tied, and patients are traveling 2-3 hours to get care, which is unfortunate, but sometimes the reality. So that's my email. I think I'm done. I will be around, obviously, for questions. So thank you, Helen.
Oh, well, thank you so much. We will see if we've got any questions here. I do want to say, thank you to both of you. I know that you're both extremely busy, and we're very appreciative of the time that you're able to provide. A lot of what PCOH does, is we look at, we listen, right? We're listening to the problems happening in Pennsylvania and try to figure out solutions, try to figure out where we could find partnerships. And even just as you were talking, Dr. Bahn, and you mentioned about how many pediatric dentists are retiring, we've never run those numbers, but we do have them. So the licensure survey does ask how soon you're planning to leave practice, whether it's 1 year, 3 years, 5 years plus. And so we can actually run those numbers for just the specialists, and we've never done that. So now I'm sitting here going, that's a data set we probably need to look at and see. We know overall that, close to 20 to 30% of our dentists are planning to retire in the next 5 years. That's the numbers reported from the last survey. So it would be very interesting to run that general dentist versus specialist and see where we're at, broken down by specialist. Because, you know, what if the majority of those retiring are pediatric dentists? Then we're going to have an even bigger problem than we have right now. So very, very excited. So thank you. You've already given me an idea of what we need to do next in our data search. So I appreciate that. I do know we had a question come in, and hopefully I'm going to ask it appropriately. But I think it was really a question for both you, Dr. Mountain, and you, Dr. Bahn, to talk a little bit more about if there's experience with, are the residents having exposure to seeing patients with disabilities? Dr. Mountain, you want to take that first?
Yes. Yes, they are. They have a scheduled day once a month where they're treating patients. Sometimes the day, depending on the patient, the volume, the demographic of the patient, or just where the patients are, ends up being more of a screening day where the patients are able to engage in care in the traditional setting. And we're working to have them scheduled to receive care in the OR, because the residents do go to the OR, and that's a patient population that they provide care for.
It's peds is basically we see all the special needs kiddos, and then sometimes when they do get to that stage of growth or development, when they become too big to manage, then we have outlets to send them to places. But yeah, we try to get as much experience and exposure to special needs. Again, really, really sick kids, really, you know, severe situations like that. A lot of times those are in certain children's hospitals, but I mean, you know, any kids with, you know, autism, any kind of sensory kids, all kinds of just these other very common things that, you know, go on all throughout the state. Obviously, we see those kids all the time, and it's sometimes providing different resources, different treatment modalities to these kids. You have to do, because sometimes you can't, you know, what is ideal you can't provide. So sometimes you got to meet them where they're at. But we live and breathe special needs kids here. So yeah.
Yeah, I can definitely imagine. And then a question, I believe, for Dr. Mountain. Where's the best place to start if you were thinking about starting a residency in your dental FQHC?
So, in thinking about the GPR, I think you have a couple of things that you can consider. If you have a local health network that's willing to partner with you, if you have a learning institution like a school, and then there's always the NYU Langone program, where they actually have more satellite sites. So you can bring residents into your FQHC without actually starting a residency. So I would evaluate, do you really want to start one? Or do you want to partner and become a satellite site? Did that answer the question for the person? I hope it did.
I think so. And we can certainly make connections afterwards if we need further discussion there. But I think that makes a lot of sense. And I do know that, you know, obviously the University of Pittsburgh is trying to do some of that with their general residency program right now. So that's certainly an option in the area. And actually, Dr. Bahn, when you mentioned about like where would we put a pediatric residency in the circled area, I was actually looking at Indiana, PA, because Indiana just started their medical school, and we've been kicking around like, wouldn't that be so amazing if we could do something dental in that space? So, you know, something to keep in mind once they get off the ground and things are moving forward, because that area could definitely benefit from that. So I think we had one more question here. Just thinking about one of the big things we keep coming into is sort of this divide between like general dentistry services and specialty dental dentistry services. And I'd be curious actually to hear from both of you just sort of where you see that alignment, because I feel like, and maybe I'm speaking out of turn, but I do feel like we're seeing sort of the general dentist giving up on some of the more specialty care and sort of not wanting to do that. And so, you know, it's sort of, I guess I'm just asking sort of what are your thoughts and feelings on if there's more potential for that to overlap, or if we're seeing ourselves go in that trend where we're dividing general dentistry from specialty care. And we can start with you, Dr. Bahn, on that from a pediatric side, because I know we encourage general dentists to see kids, but less than half of our dentists in Pennsylvania will see a child under age 3. And to me, that's terrible. So I'd be very curious to think if pediatric really can pick that up.
I mean, there's only so many of us to go around. You know that. We've just talked about this for the last hour. There's only so many of us to go around. So, I would encourage, again, the dental school's only can do so much. The GPR is only can do so much. I mean, I think once you're out in practice and you realize, you are turning away these kids that are 3 and 4 years old, like, why am I doing this? Is this going to be something I have a moral obligation to do? I should be doing this. Like, reach out to a pediatric dentist, reach out to somebody who can maybe help you out. Like, is there some CE courses? Do you have courses like that we can like just go over some basic stuff and like, hey, you want to see these kids? Like, what can we teach you to do that, here's when you refer, here's when you keep them, and then here's what we would expect or ask for you in the first, 3, 4, 5, 6-year-old visits, like what to do and try to do. Try to hold on to them without being, negligent. And when there's a time, send them to where they need to go. So I have struggles even within my own specialty issues because I had a kid this morning that I need to send to endo, and there is no endodontist that I know of that will see pediatric patients that are special needs. It's a tough window. So we make it work. We have routes and we have, places, but it's tough. But yeah, I would encourage all the GPs to, reach out to try to find a pediatric dentist mentor, and or if we could have some kind of CE courses available to say, hey, like here's what you guys can do. Here's what age 3, age 4, age 5 visit should look like. And then here's what you're looking for. So, but yeah, you got to keep learning. So just got to keep educating them.
I would share other things like Dr. Bahn just said, we talked about, they're under tremendous pressure. So they're trying to figure out how to be efficient with certain procedures that are going to earn them the dollars that they need to cover all their expenses, right? So they are making business decisions, which isn't helping the community. The new grads and the residents that we have come in, it's not an option for them to not see because this is the community. So as Dr. Bahn stated, we're going to pair you with a doctor. We're going to train you, because if we don't engage them in those early years, then the time we see them that they really need us is going to be a terrible visit because they're swollen. It's not great. They're in pain. So we encourage the individuals that come through our community into our department to not limit any of their skills. There's always going to be patient and case selection that is it's not feasible to see in this environment. But for the most part, if you have the skill level, you have the chair time, we'll figure out how to help those GPs get to where they need to be, because in most cases, they come back to us in a worse state than they presented the first time. So that's our goal and that's our approach, that we engage them young and we spend more time on preventative care than anything else. And as Dr. Bahn said, some of the stuff is really quick techniques that they can learn, from the knee to knees to one of the things he spent a ton of time with conversations with parents, which is interesting, with new grads and with the residents. So there are some things that we could consider or see if can be provided if you all are willing to step into that space to create some type of series to just provide some education, since it's obviously a deficit, an area that we need some more activity around.
Okay. That sounds great. I think that, again, just want to say thank you again so much for all of your time today. Just as a reminder for you guys, as we always share, continue to drum up business for dental careers across the state. We continue to maintain our speakers bureau. If anybody out there would love to go and talk with the kids in middle school or high school about dental careers, we're happy to help in that space and match you up with some different opportunities in your area. So check it out. And with that, I think we are going to wrap up just on time for today. Thank you guys all so much, everyone who was able to join us today. We really appreciate your time. And a special thank you to Dr. Mountain and Dr. Bahn for joining us and sharing some of the insight about these residency programs. So stay in touch, and I hope you guys all have a beautiful weekend. It is supposed to be gorgeous in Western PA, so hopefully you're all going to get some of that great weather. So thanks a lot, everybody, and we'll see you next time.